give you a quick overview of the session today. We are going to provide an overview of the Missouri Foundation for Health's firearm violence and suicide prevention efforts, kind of help you understand the impact of firearm violence, primarily firearm suicide, on rural communities, talk about the Safer Homes Collaborative and its efforts to establish common ground between suicide prevention and the firearm owning community, and talking about how to integrate lethal means reduction strategies into professional practice. Just to start off quickly, if you're not familiar with the Missouri Foundation for Health, the foundation really takes a multifaceted approach to health issues, understanding that programs, policy, and collaboration all play a role in lasting impact. And we want to start out our talk today a little bit, just giving you some context about firearms death in Missouri. What we know for certain right now is that the burden of death by firearms in Missouri is severe and has been getting worse over time. Missouri's gun death rate has been steadily increasing over the past decade. For example, in 2018, we lost over 1,300 Missourians to guns and actually had the highest rate, fourth highest rate in the nation. In addition, the estimated cost of gun violence in Missouri is around $9.8 billion a year. This includes medical costs, costs to the criminal justice system, the loss of workforce, revenue to businesses, and intangible costs associated with quality of life issues for victims, families, and communities. In terms of firearm death in Missouri specifically, we know that suicides involving firearms are actually the leading cause of firearm violence deaths in the state. More than half of the gun deaths in the state were a result of suicide, while around 4 in 10 were classified as homicide. And that other small percentage it includes things like accidental or other unintentional firearm deaths. We also know that firearm violence impacts communities differently, with causes of injury and death varying by age and race. So, for example, the data indicates that Black men between the ages of 15 and 34 are 26 times more likely than white men of the same age to die as a result of firearm suicide, while those who die by firearm suicide are most likely to be older white men. Here's some additional data just around firearm suicide in Missouri. Rural areas in Missouri have slightly higher suicide rates than metropolitan areas. We also know that around 63% of suicides do involve firearms. So that's a much more, or it's a greater extent than any of the other types of ways that someone may die by suicide. And of course, firearms are the most lethal means. So 90% of those who use a firearm do die. So in terms of kind of the Missouri Foundation for Health's work, we have been really working across 2 initiatives, both firearm violence and firearm suicide prevention. Our firearm violence work began in 2016 and really was looking to build a strong foundation of information and networks to enable groups to effectively influence the systems and structures that underlie firearm violence. In terms of strengthening the networks, we're really looking at how to support alignment, coordination of efforts, how do we support community-driven approaches, and as well as really working to strengthen the foundation of information around firearm violence and firearm injury and death in the state. So this has included research and dissemination, communication strategies and framing. And we really began our work under the umbrella of firearm violence. However, we've considered all types of firearm injury and death under firearm violence. So we talk about it in terms of interpersonal, community violence, firearm suicide, unintentional, and accidental. And in 2020, we actually started a separate initiative that's still very interconnected to the firearm violence work, but specifically looking at firearm suicide prevention. And we really work to reduce firearm suicide in targeted populations, promote effective messaging that shifts the narrative about firearms and suicide, and increased focus on firearms suicide within developing state comprehensive suicide prevention efforts. And across both of these initiatives, we really envision promoting a shared understanding of the impact of gun violence, including suicide, on Missouri communities and solutions to reduce firearm-related deaths and injury. We hope to build public support for this work in which we are engaged and around the need to make our community safer and healthier. Hope working to shift the narrative, improve quantity and quality of public discussion, and resulting in more will for change. We'll talk about our research and community-based solutions, specifically around firearm suicide and the firearm violence work. Despite the fact that firearm violence affects all Missourians severely, talking about it is very hard. So last fall, we completed a series of research studies in collaboration with the Frameworks Institute. This work really looked at how to depolarize the issue and effectively frame conversations about gun-involved accidents, suicide, and intentional harms and the steps we can take to prevent them. We are dealing with a complex challenge. There's a committed opposition, people with strongly held views. What we see with those kinds of issues, we typically see things, what we call the spiral of silence. As a view becomes unpopular, supporters don't speak up, and the tendency of people to remain silent when they feel that their views are in opposition to the majority view on a subject. So soon, all we hear are one side voices skewing public opinion and political climate. As we'll highlight later and see in the data, the frameworks research, along with some of our Missouri firearms data, can provide support for those areas in which we all can agree within the conversation around firearm violence and suicide prevention. I won't go into all the recommendations and highlights from our frameworks research. There are several key takeaways listed there on the slide. There is a full report, and if you reach out to me, I'm happy to share that report and recommendations with you. But I just want to highlight a couple of things. One, we found with this research really to emphasize the problem of firearm suicide, using this as a segue to other firearm violence prevention issues or as a standalone issue. To elevate the issue of gun violence and build support for programmatic and policy reform in Missouri, talk about suicide as an example of why we need to take action to keep people safe from firearms. Be clear that suicide is preventable, keeping the focus on access to a firearm, and looking for opportunities to really highlight different communities affected by suicide. In addition to our frameworks research, we've also undertaken a Missouri Firearms Survey, and this was really based on the 2015 National Firearms Survey, which asked participants about gun ownership behaviors, as well as perceptions of gun safety and violence. About little over 1,000 adults from Missouri participated in the survey, and we really wanted to make sure we had a big enough sample of gun owners and those from rural areas. So we recruited extra people from those groups. This required some additional adjustments during data analysis to really ensure that survey sample, it represents the Missouri population when it comes to age, race, ethnicity, education, income, metropolitan versus rural location, and reported gun ownership. I wanted to just share a couple of the key findings from the survey that helps put context around firearm ownership in rural areas and some of the perceptions held by rural gun owners and safety and suicide risk. So first off, Missouri gun owners were more likely to identify as male and be over the age of 30. This really tracks with the characteristics of gun owners from the national sample. However, the national sample found that people living in rural areas were more likely to be gun owners, but within our sample, rural participants were more likely than those living in non-rural areas to have guns within the household, but were no more likely to report personally owning a gun. The data revealed a disconnect between perceptions of gun violence and realities. When asked about the issue of gun violence in Missouri, 64% of all participants considered gun homicides to be the most pervasive problem, while considerably fewer identified gun suicide as the most pervasive, despite the fact that over half of all gun deaths in Missouri are attributed to suicide. I think this really speaks to people viewing this as an interpersonal issue. This was also confirmed in our frameworks research, as many people did not see firearm suicide as part of the firearm violence conversation or issue. There really is an opportunity to elevate firearm suicide as an issue and help people understand the impact on Missouri communities. When it comes to perceptions of guns, majority of firearm owners and non-owners believe that having a firearm in the house makes it more safe as opposed to more dangerous. However, what we do know is ownership does increase risk of accidental injury, suicide, and homicide. As we mentioned previously, many people see this as an interpersonal issue rather than self-harm or accidental, which really may begin to explain why they believe having a gun makes the household more safe. We also found that the majority of all participants believe that physicians and healthcare providers should talk to their patients about firearm and firearm safety if the patient or the patient's family member is at risk for suicide, has a mental or behavioral health problem, or is going through a hard time. And we really found not much difference between rural and urban gun owners for this. And I just want to briefly touch on a couple of the community-based efforts that the foundation is supporting. We are working with a group called the American Foundation for Firearm Injury Reduction in Medicine, or AFIRM, and they are leveraging their expertise and evidence-based approaches to preventing firearm injury and death to train a pilot cohort of clinicians in Springfield, Missouri. Activities under this project really include a needs assessment to understand factors associated with firearm injury and mortality trends, and a reframe event for stakeholders to further promote community engagement and buy-in on the topic of firearm injury prevention as a nonpartisan public health issue, and provide clinician training interventions, such as curriculum, educational programs, and other supporting materials. This program has a focus on all types of firearm injury and death, but firearm suicide has emerged as one of the key ones, as it's kind of the most prevalent compared to homicide, firearm homicide in the Springfield area. Not on the slide, but I wanted to briefly mention too that we are working with the Kansas City Star and other journalists across the state on a Missouri gun violence reporting project. There have been a number of different articles in the Kansas City Star, St. Louis Post-Dispatch, and some of Springfield and some of the other media outlets across the state. These articles have focused on a variety of issues, from domestic violence involving firearms in the Springfield area, poverty and firearm suicide in the Southeast, as well as a feature on a teen who died by firearms, died by suicide using a firearm. And that was kind of the focus of the firearm suicide of many of the stories that they've put out in the past year. And then just lastly, I wanted to mention our firearm suicide prevention planning grants. This cohort is made up of 8 organizations working on 7 projects across the state, each with their own target population geographic focus. You'll notice many of those are in more rural counties in the state. And really the purpose of this grant program is to support organizations in planning the development of a program for populations with high rates of firearm suicide. Many of these grantees, as I mentioned, we're working in rural areas and are really working to engage multi-sectoral partners around the issue and better understand the impact of firearm suicide in their community. These grants started earlier this year. And then our other project that we are working in partnership with Katie's group, Safer Homes Collaborative, and the Missouri Institute for Mental Health. And so I will transition over to Katie now to talk more about that.
Oh, thanks, Jessi. Do you want me to share my slides, or are you good to just advance the slides?
I can advance them for you.
Okay, great. Go ahead and you can advance to the next slide, please. Hi, everyone. I'm Katie Ellison. I'm the project director for the Safer Homes Collaborative, as Katie previously introduced me. I have a background. I started off my career working in youth and adult corrections as a diversion officer, probation officer. And then I wanted to move further upstream and to work in, had the opportunity to work in prevention programs in schools in my hometown in Northeast Wyoming. And our community experienced over 80 suicide deaths. 15 of those were current or former graduates from our local high school that were under the age of 20 in a 6-year time span. And that is where my work in suicide prevention formally began. However, I'm also a suicide attempt survivor. Very grateful for that. And so that really forms the basis of a lot of my knowledge and understanding and experience. And then I had the opportunity to join MIMH and be part of this project working towards gun suicide prevention. I like to know a little bit about the folks that I'm presenting to. So if you don't mind sharing your role within your organization, if you are an MSW, if you're a physician, a nurse practitioner, perhaps a mental health nurse, just so that I have kind of an idea of the audience who is here with us today. That kind of helps me tailor some of my comments as I go forward. And we're going to be using the chat box, especially when we transition, if you stick around for the CALM training. So this is a good practice to get comfortable with using the chat box. As you enter your information into the chat box, I want to talk a little bit about the Safer Homes Collaborative and some of the frameworks and ideas behind a gunshot project. The idea for a gunshot project actually started in New Hampshire back in the 2000s. I think it was about 2006, 7, 8-ish, somewhere in there. Where this community in New Hampshire experienced in fairly rapid succession 3 suicides of community members. And the local county coroner, in doing his investigation of those suicide deaths, just happened to collect the information that they all had purchased their firearm from the same gun shop. It was Riley's Gun Shop. A very well-known firearms distributor in the state of New Hampshire and in that particular region. And he shared that information with the owner of that store, Ralph D'Amico. And Ralph was very alarmed and moved with the knowledge that 3 of his customers had purchased the firearm that they used to bring about their suicide death from his store. And so there had been this loosely formed firearm safety coalition. And also in participation with that was my colleague, Elaine Frank. And they really started this ball rolling. Elaine's background is in harm reduction. She worked at Dartmouth College. And so they really got this ball rolling of how do we have this conversation about safe storage of firearms, how firearms can, if we prevented quick and easy access to firearms in a moment of extreme crisis, despondency, and despair, that we could prevent suicide. And so it is because of the gun-owning community, the gun retailing community, who wanted to get behind this effort, that the Gun Shop Project, this model, has been replicated in over 20 states. It's probably more than that, but over 20 states that we know of for sure across the United States. It's mostly done at a grassroots level. Ours certainly follows that. So we largely shaped our process, our protocol, and set the goals for what we wanted to accomplish in this grant based off of the model that was set by the New Hampshire Firearm Safety Coalition, the Colorado Firearm Safety Coalition. We reached out to our colleagues at the University of Washington that had the Safer Homes Suicide Aware Project. And then we tapped into the research, knowledge, and expertise of Kathy Barber, who is at the Harvard T.H. Chan School of Public Health, to really create our model and to learn from their experience with best practices. Hey, Jessi, you can go ahead and advance. So this is our catchment area for the grant that we received in 2018 from Missouri Foundation for Health. It doesn't encompass all of Missouri, but it encompasses a large, the majority of the counties across Missouri. So within the confines of this catchment area, we wanted to collaborate with 1,200 gun shops across the state. And when I say gun shops or gun retailers, under that broad term, I'm including pawn shops that retail firearms. Maybe they consign it or resell firearms. Shooting ranges that provide folks with opportunities to go out and practice their shooting skills. And then also sporting goods stores or other stores that might sell accessories for firearms. Maybe they sell tactical gears. Maybe they don't sell firearms specifically, but definitely they supplement and support the firearm retailing industry. So to identify those 1,200 gun shops, retailers that we wanted to target, to reach out to ask if they would be willing to partner with us in promoting the message that safe storage of firearms by reducing access to firearms from people who shouldn't have a firearm would reduce suicides in Missouri. We identified, well, actually, we accessed the Alcohol, Tobacco, and Firearms Federal Firearm Licensee List, the FFL list, for the state of Missouri. And there's over like 2,300 FFLs listed on that list. And we narrowed it down to nearly 1,900 FFLs within our catchment area. And we thought, a piece of cake. If there's 1,900 FFLs, easily we can reach out to 1,200 over the course of 3 years. So we broke it down into regions. And then as we started going through and culling this list, we started to realize that only 30% of the FFLs that were on the ATF list actually met our criteria of who we wanted to target. We wanted to partner with businesses that had a brick and mortar storefront, that had a customer base that came and went. We didn't necessarily want to target manufacturers. We didn't want to necessarily target, although we looked into it a little bit, and it turned out to be a barrier that we just didn't want to put our time and resources into overcoming at that time. And we didn't necessarily want to target people that were on the FFL list who had that license for personal use. So in the United States, a lot of people purchase firearms online through online retailers. And in order to have that firearm shipped, it has to go to someone who is a licensed FFL. And so in order to facilitate that process, many Missourians get a personal use FFL license for their own use. Maybe their friend will purchase a firearm, and for the $25 processing effort, they'll charge them, a nominal fee to have that firearm transferred to their friend sent from whatever state in the union to their friend here in Missouri who has the FFL license, and then they turn it over to the person who had purchased the firearm. And those weren't necessarily the folks that we wanted to target as well, because they didn't have necessarily a broad or consistent customer base, as we found, unless they were really busy. And so this was in 2018. The list that was available from the ATF had last been updated in 2017. And actually to this date, the list that's still out there on the internet was last I checked, which was way earlier this year, had not been updated since 2017. So as we started going through the list of the 800 or so FFLs that fit our criteria of who we wanted to approach and ask to partner with us, we've started to discover many of them had let their license lapsed, or that their business had closed, or that it wasn't a good contact information. The address and the phone number wasn't a good contact. So that narrowed down our potential contacts even more. So we had to get really creative and use good old Google search keywords, Googling firearms for sale, Missouri firearms for sale, shooting ranges in my area, to really kind of beef up and identify who our potential audience, or who our target audience could be, or who we wanted to approach. Next slide. So these were the three, I kind of have my slides backward, but that's okay. So these are kind of the three key tasks that we wanted to accomplish over the course of the 3 years of the grant. So we wanted to collaborate with firearm retailers to promote safe storage of firearms to prevent suicide. We wanted to train retailers and gun owners on how to have conversations with customers, with their fellow gun owners, if they identified someone who had access to a firearm and also might be at risk for suicide. Maybe they were exhibiting some of those warning signs. We wanted to train gun owners and retailers to be able to recognize that and to have a conversation with their customers or with their gun owning friends or peers about, firearms are extremely lethal. Most people who attempt with a firearm do not survive that suicide attempt, and that there are common sense strategies and layers of protection that can be put into place in the home that can keep a firearm safe from, or safer from, resulting in tragedy. And then our third goal was to build a collaborative of gun owners within Missouri, as well as non-gun owners, to work with us to address gun suicide. And we really wanted to engage gun owners to not only inform our approach, but we wanted their buy-in to drive this effort. If they had passion for this cause, if they had been impacted by the tragedy of suicide, we understood that one gun owner to another gun owner would have far more credibility in promoting this message and sharing this knowledge than, say, someone like me who is not a gun owner. I don't know the language. I don't identify as being of the gun owning culture, but I'm of the suicide prevention world. I'm of the suicide prevention community. So we wanted to empower the gun owning community with this message and to be the messengers of the message. Jessi, go ahead, next slide. So we had to start kind of from scratch. We had to create all of our print materials. This is part of our toolkit that we took to retailers and asked them to display. We asked them if they would hang up our poster sharing knowledge about gun suicide. We adapted the 11 commandments for gun safety that came from the New Hampshire Firearm Safety Coalition that talks about all of the standard gun safety best practices, like never point your gun unless you're prepared to shoot, don't put your finger on the trigger until you're ready to shoot, store your firearm locked and unloaded in your home for most safety. And then we added the 11th commandment, which was asking them to consider either temporary offsite storage of firearms when someone is at risk for suicide, or consider layering safety practices to make that firearm less accessible and perhaps less lethal if someone should gain access to that firearm during a suicide crisis. Then also in our toolkit, we included the wallet card for the National Suicide Prevention Lifeline that lists the 10 warning signs or several warning signs, for suicide. And then also the National Suicide Prevention Lifeline magnet that they could stick anywhere, a refrigerator or a gun lock or anything metal that had the phone number for a resource that they could reach out to for help if they wanted to. Next slide, Jessi. We also wanted to provide them with some written literature, them being retailers, some knowledge, some answers to frequently asked questions about, how guns are more lethal than any other method. That folks, if they have the plan to attempt suicide with a firearm, typically, they don't switch to another method if they can't access that firearm. And any other method that they might switch to other than a firearm is far more survivable than if they were attempt with a suicide with a firearm. We also wanted to thank them for partnering with us as a part of this project, and let them know that there's additional training available as far as the CALM training, conversations on access to lethal means, and then invite them to be a part of our collaborative, journeying with us and helping us to be much more effective and efficient in promoting this strategy. Next slide, please. So here's some outcomes from our visits to these gun shops from 2018 until currently, until this month. So we started hiring field coordinators not long. The grant started in May. I started in June. We started recruiting and hiring field coordinators across Missouri not long after I started. It took us a little time to recruit. It took a little bit of time and building relationship and assuring our field coordinators that what our motives were for this project, that we weren't anti-Second Amendment, that we were not anti-gun, rather we were pro-gun ownership rights. We just wanted to raise the awareness amongst gun owners that they have a role that they can play in preventing the tragedy of suicide. So we started officially making field visits. We wrote up our protocol, culled down our list and identified where we were going to start our outreach, and started making field visits in person in about October of 2018. So from October 2018 until April 30th of 2019, we were able to approach almost 300 visits. And at that point in time, we only had two out of our 6 field coordinators hired. And then 2019 and 2020, we ramped up in that second year of the grant. We had all 6 field coordinators hired, and we were able to reach out to over 900 or almost 900 gun shops and shooting ranges and retailers across the catchment area. In 2020, we were off to a great start, and then COVID hit, and we had to shut down because we're affiliated with the University of Missouri at St. Louis. We fell under their rules and their guidelines during COVID. And so we had about 6 months where we could not do in-person visits. We had learned from the first year and a half of the project that cold calls to businesses were not a successful strategy or not a successful approach. The retailers are very busy helping customers that are directly in front of them. And this conversation can take 10 to 30 minutes, in order to for our field coordinators to get buy-in from the retailer, to get them to be on board. And so we really found that strategy, the approach was best in person. So we tried going back for a time to doing the cold calls, but really during the early part of the pandemic, everyone was shut down. And then in around May-ish of last year, retailers took off with a boom because of the civil strife and unrest in the country, and actually gun sales were setting records. And so they just didn't have time for our phone calls. So we shifted gears a little bit. We did some qualitative data research until we could go back out in person. And then what we started to realize with the gun sale boom is that, our materials we needed to have our materials out in the gun shops to reach the new customers, to reach the repeat customers. So we really focused on the follow-up visits, the returning back to the places that we had already established relationships. So in total, to up until today, we have reached out to almost 1,300 locations to place our toolkits. We have had, I'm having a hard time reading this, we've had about 730 of those almost 1,300 agree to partner with us. Some of those places, when we actually went there to make a visit with them, they told us they weren't interested. There was certainly a handful of those, or a good share of those who weren't interested. There were some that, they were on our list. We went there and we visited them, and they're like, I got out of the gun business. I can't sell them. I can't move them. I can't get inventory. It's not a large enough part of my business. So I don't have firearms. So we counted them in our approach, even if for whatever reason that they said no. And then we were able to distribute over 800 of those toolkits. Many or several places allowed us to place more than one toolkit. So as we went along, and needing to widen that aperture of who we approached to reach kind of that 1,200 mark, we started including organizations where gun owners might be prevalent, such as veterans organizations, veteran serving organizations, the VA hospitals, the American Legion, Veterans of Foreign Wars. And so those helped us to reach that almost 1,300 contacts. Okay, next slide, please, Jessi. So this is just kind of a data dump of the quantity of resources that we have distributed. So in terms of that, those 11 commandment brochures that we distributed, there are over 30,000 pieces of literature floating out there across the state in the catchment area. And then about 16,000 pieces of literature for both the wallet card and the magnet from the National Suicide Prevention Lifeline. So just showing our data process, or a process for our toolkit of how much material we were able to distribute over the three years. Next slide. All right, so part of our process that we wanted to do is kind of measure, how much is being taken, how much is actually being picked up by folks out in the field. And so our field coordinators did a 6-week follow-up to businesses. Initially, we started out wanting it to be really good research model, in that we were only going to do one follow-up visit to each of the locations that we had agreed to display a toolkit, and we were going to go back and visit after 6 weeks to find out how many pieces of literature had been taken, restock it, and then we would just keep moving on. Well, when we hit the COVID pandemic last year, we shifted gears. We felt it was much more important that the resources, that the materials were out there, reaching those new gun owners, reaching repeat customers about the risk, because we understood that many people, that the COVID pandemic was going to contribute to exacerbating risk factors for suicide. And we knew that having access to a firearm in the household increases that risk in that household for dying by suicide versus someone who doesn't have a firearm in their home. So we shifted gears. So in terms of how many pieces of literature that we've replaced in those 3 years, you can see, even though we've placed over 32,000 pieces of literature at one point or another, this is what we actually replaced. So we believe over 16,000 pieces of our 11 commandments have walked out the door in people's hands. 15,000, I'm not sure if I'm reading that correctly. maybe almost 15,000. Sorry, it's really small on my screen. Almost 15,000 pieces of the wallet card from the National Suicide Prevention Lifeline, and then almost 10,000 magnets. So we recognize that these resources aren't necessarily going to prevent death, aren't going to save people from suicide in and of itself, but it's knowledge, it's awareness raising. It gets people talking. And that's what we want to do in terms of shifting the conversation among gun owners. So I see Sarah has asked a question in the chat box. Did suicide rates go down in the areas where you were targeting? What's the impact on suicide rates as a result of our work? Comparing rates, are you able to track access or access any data you have regarding access to firearms? So in terms of suicide rates going down in the counties that we were specifically targeting, the data for suicide is always behind the curve. Like with COVID, we're jealous, we're envious, because we can get almost real-time data in terms of people who are testing positive for COVID. We can get almost real-time data for people who are dying from COVID. When it comes to suicide, that information comes from death certificates that local county coroners complete, that they fill out. And that can take that process for them to complete their investigation and submit the death certificate to the Department of Health and Senior Services can take upwards of 180 days. Then the Department of Health and Senior Services has to cull and collect that data. So the hard data for the state of Missouri runs about 3 to 6 months behind. So we just recently received some preliminary data for 2020. But we don't have it drilled down by what's called Burfus region, which kind of mirrors what the Missouri Foundation for Health region outbreak looks like. They haven't drilled down that data that detailed to the specific counties. And we won't have that detailed of data for 2020 until like December or early January. However, preliminarily, and this comes with a caveat that this is subject to change, it's subject to as they crunch the data. The way it works is that if you reside in a county in Missouri, but you die by suicide in another county, or if you live in Missouri and you die in another state, that death comes back to your county and your state. That's part of all of that norming that happens at the CDC and the Department of Health and Senior Services, Health and Senior Services. So it's all a caveat that in 2019, from 2018 and 2019, our suicide data or a suicide number, just that raw number of suicides, had a drop, about a 3% drop in total suicide deaths. Then from 2019 to 2020, here again is the caveat, we saw a second drop in the number of suicide deaths. What we don't know is how this was driven. We don't know if this was driven by gun deaths that reduced, or if this was driven by other means or methods of suicide that was reduced. And then another caveat that might play into how the number of suicides in 2020 decreased was that the number of overdose deaths, both in Missouri and in the United States, increased by 30%. Unprecedented, never before seen increase in the number of overdose deaths. And so it's hard to determine how many, or to quantify how many of those deaths that were ruled an overdose might have actually been a suicide. So it's muddled. So yes, the numbers have come down for 2020. How that's going to parse out or drill down, we don't know. So whole lot of probably more information that you wanted to know, but the information will eventually be there. It's just slow in coming. The data should show if death by firearm, and it will be very interesting to see. Yes, it will show if it's death by firearms. We just have to wait until late December, early January, when that data becomes available and is published by the CDC. Next slide, Jessi. So we wanted to hire field coordinators who were regionally located in their parts of the state, in each region that we had identified. And so recruiting them and helping them to understand what the motive and the mission was behind our message, we wanted to first and foremost hire people who first and foremost identified as being gun owners, being a part of the gun community, being in the gun culture. So Sheila, she is a former St. Louis Police Department, City Police Department officer. She's currently employed with the Safety Department at St. Louis University. Bill, he is here in the St. Louis region as well. He's a certified NRA piston instructor, so he is a gun safety instructor. Kurt is located in our Jefferson City, and he also covers our Northeast region. He is an avid hunter and gun enthusiast. His background is sales, and so he came with a lot of strength and skill in how to turn someone who starts out as a no and shifting them to a yes. He brought great value to our project. Cameron, who's down in that lower left corner of your screen, he was a nursing student when he started working with us in 2019 and has since graduated. He's in the Springfield area. Cameron is a veteran from the United States Army, and he's also in the Missouri Army National Guard, gun enthusiast, hunting enthusiast. Chad in the center bottom there, he's in our Cape Girardeau area. He is an LPN by trade. He's currently working for his community's fire department full time. He's very engaged and involved with the local American Foundation for Suicide Prevention chapter, as well. Grew up in gun culture, grew up in Southern Missouri, shooting guns, very comfortable talking the talk and walking the walk. And then Tim in the lower right corner of your screen, he is down in our Boot Hill region. He's actually Cameron's stepfather. And Tim is a hunting enthusiast, knows a lot about firearms. And so there are people embedded in this community that have relationships, they're customers with these retailers. And so we taught them to be suicide prevention advocates. They all came with their own story about suicide and the impact suicide had on their lives, having lost someone to suicide. And so we kind of took it a reverse direction that might seem logical, from being a suicide prevention expert first, and then adapting them to being a gun expert. We took gun experts and trained them up to be suicide prevention advocates. And so they're out there across the state making contact. Katie, how am I doing on time? I want to do a time check.
I'm sorry, you've got 10 minutes to go. So you can keep rolling if you want, or we can start with questions.
I'll keep rolling. Okay, go ahead, Jessi, next slide. All right, so we wanted to create the CALM training. So we partnered with Elaine Frank, who made the original version of CALM called Counseling on Access to Lethal Means. This is a 3-hour high-level training for medical providers and clinical providers, behavioral health providers, to have conversations with their patients in the hospital or patients in the counseling office about reducing or limiting access to firearms as part of a safety strategy or a safety planning with those patients who might be at risk for suicide. Can you advance, Jessi? So we developed the 1-hour version. We adapted the language, the terminology. We really sussed it down to make it conversations on access to lethal means. We also adapted our video so that we could, so that it really spoke to gun owners and demonstrated how everyone can learn how to have this conversation. And then we went to our third, Jessi, you can go ahead and advance. We adapted that yet again to bring this training to first responders. We had the opportunity to adapt this training so that those who go out on those 911 calls and respond to people out in the field, how they can have a conversation with someone who is at risk for suicide or their family members about what they can do to keep their homes suicide safer. Next slide, Jessi. So this just kind of sums up what the tenets were for the conversations on access to lethal means. It is based on best practices that are evidence-based strategy. We also wanted to measure it for efficacy to make sure that that the training that we created did what we wanted it to do. And we wanted to ensure that people understood that the CALM training is not anti-gun. We're not even anti-suicide or anti-drugs, I'm sorry. We're anti-suicide, meaning that we want to give folks some tools that they might not think about in order to keep their loved ones safer in the chance that they are thinking about suicide. Next slide. And so after we developed the conversations on access to lethal means with Elaine, we started out thinking, oh, 2 trainers will be enough to take us through this process. Well, we made our in-state let's go to the next slide, since I'm running short on time. We were also able to increase participants' comfort and confidence in having this conversation from pre to post, and then also over time. Next slide. And then our third tenet was to build a collaborative of gun owners and non-gun owners to help inform our project, like I said previously. Next slide, please. So some lessons that we learned across the way, across time, is that we really had to, I personally had to shift my thoughts so that this conversation, this dialogue didn't get mired down in politics. It didn't get stuck with Second Amendment rights versus gun control policies. That was not our focus, not our emphasis, and we really needed to lead with that. And so we all had to maybe do a mind shift because we have a very diverse group of folks from lots of different backgrounds working on this project and informing the effort. And so we really had to align ourselves with the gun owning community and focus on safety. Next slide. We also had to, I was pleasantly surprised. I expected to have much more resistance and obstacles from the gun owning community, from the retail community, that they wouldn't want to be a part of this effort, that they wouldn't want to get involved. And what we learned is they want to be a part of this. Many retailers, more than not, had somehow been impacted by suicide in life, that they could tell their own story of suicide, either in their family or their community, but they just didn't have a way or know how to get involved. And so it was wonderful to see, but really challenged my false assumptions, my erroneous assumptions that we were going to have to overcome the gun owning community. We didn't. Which made it that much easier for us to move forward. I think it also helped that we had messengers who were of the gun owning community, first and foremost. Next slide. And then finally, we found our champions within the gun owning community. This is a picture of my friend, Joe Gilbert. He is a retailer in Columbia, Missouri. Joe got on board right off the bat and wanted to be a part of this. He had a customer die by suicide at his shooting range on his property. And the fallout from that, the ramifications from that, the cleanup from it, the whole process rattled him, impacted his staff and his frequent customers. So Joe has become a huge advocate for us within the retailing community. He got trained to be a CALM instructor. He's done radio spots. He's done guest speaking engagements. So we found our champions who wanted to own this message and take it forward. He is also a resource that I can call and ask an embarrassing or seemingly stupid gun question that I, just don't know the answer to. And he's completely non-judgmental. He loves being an educator. He loves sharing his passion for firearms with people who are curious and have questions. And he's just been a fantastic resource. And we need more Joe Gilberts across the way. Next slide, please. All right, so that is our presentation on what we've been doing with Missouri Foundation for Health with the Safer Homes Collaborative across the catchment area. I see that Katie has prompted you all to go ahead and ask questions. I'm fine if folks are able to unmute themselves as well to call out and ask their questions.